Welcome to another edition of the DAMY Vlog. My name is Dr. David Duizer. Thank you so much for tuning in. On this show, we cover all things holistic health and wellness related. If you're interested in holistic health and well-being, please subscribe to our channel for more videos like this one. Today on the show, we're talking about magnesium intake and its effect on vitamin D status. If you are interested or passionate about holistic wellness in general, you know the importance of magnesium. It's most commonly known now for its positive effect on sleep when someone has a history of insomnia. Its secondary most popular usage is in muscle tension. So we see tons and tons of people taking magnesium for sleep and muscle tension, but there are many other reasons to be taking magnesium. We now know that many people are deficient in magnesium because the levels in our food have gone down over the years from what they used to be. So we're seeing lots and lots of people with low levels of magnesium and experiencing the negative side effects of that. Of course, muscle tension, poor recovery, low mood, high stress, insomnia, these things can be caused by low levels of magnesium, but there are some other more tricky potential side effects of a low magnesium intake that we need to discuss. On today's show, we're talking about vitamin D status. So everybody now has been told to begin taking vitamin D. In Canada, here is the only thing really that our federal body recommends everyone consume. And what we're seeing is, after doing follow-up testings of vitamin D status, we're seeing some people take significantly high levels of vitamin D drops and report low blood levels of vitamin D. We're seeing some people take moderate or even low levels of vitamin D drops, live the exact same lifestyle as someone taking a high level, and report high levels in their blood. So what is the mechanism for this? Well, one of the potential mechanisms for vitamin D not being properly stored or utilized in the body is low magnesium levels. Magnesium is a cofactor for many enzymatic reactions, but as a cofactor, it has a significant role in transporting vitamin D around the body and converting it to its usable form. So when magnesium levels are low in the body, there is an increased risk of calcium deposition on the blood vessels. So you can have an increased risk of hardening of the arteries or even calcium buildup in the arteries. This happens when magnesium is low. So vitamin D doesn't do its job of putting calcium into the bones when magnesium's low. We also see cases of osteoporosis with low magnesium levels. And we know in both of these situations, normal magnesium levels are really helpful for the treatments of osteoporosis and the prevention of cardiovascular disease, because they have an effect on both of these systems. We have some data to show that low levels of magnesium are correlated with both cardiovascular disease and osteoporosis. So that's where we get this info from. So in terms of properly storing and then utilizing vitamin D, we know the impact magnesium has and how important it is to be consuming. So most people who come to see me who are experiencing whether muscle tension or poor recovery or chronic pain due to muscle tension or insomnia for no reason will already be taking magnesium just because of the neighborhood I live in. Sometimes we're recommending it for them if they're not already taking it, if we think it's indicated. But we end up using this clinically in other situations. For example, in osteoporosis, when we give calcium, magnesium is often included as part of the therapy. When we are treating cardiovascular disease, magnesium is used to relax the blood vessels and to help them become less tense overall. So we use magnesium for lots of different purposes. The sources of magnesium that are most abundant are things like nuts and seeds and whole grains. But you can find magnesium in lots of different vegetables and other sources as well. So magnesium is an important cofactor in the actual transport and conversion of vitamin D. And we know that we need to be considering magnesium when the vitamin D drops are not doing what they're supposed to be doing, if they're not keeping the levels stable. and we should probably be using it in other cases like in osteoporosis and in cardiovascular disease. Magnesium might be the missing link. So I really want to catch that today because a lot of people are starting to take their vitamin D now that we've hit the winter season here in Vancouver, British Columbia. But vitamin D doesn't always work, and we know that it's not that efficient if your magnesium levels are low, so it's something to be considering. The blood level of magnesium, this test for magnesium that we do here in our province, is not that reliable in the sense that the kidneys do a good job of keeping the blood level of magnesium normal. People can still experience low electrolyte type cramping. They can still experience low tissue levels of magnesium even if the blood levels are normal. So just because your blood levels of magnesium are normal as an electrolyte, as an electrolyte panel, doesn't mean that you have proper tissue levels of magnesium. So sometimes we're going above that. Even if we have a normal electrolyte level of magnesium on this electrolyte panel, we still can prescribe magnesium on a case-by-case basis and take the levels high. In fact, when we prescribe magnesium, we don't normally see that blood level go up. So that's an interesting aside. There are multiple types of magnesium. The most well absorbed is magnesium bisglycinate. Magnesium citrate we use in constipation. Magnesium oxide is a half and halfer. It's pretty well absorbed, but it still can affect the bowels negatively. It seems to be good for the cardiovascular system in general. Now we're using magnesium orotate as well. We have multiple types of magnesium. I like to use magnesium glycinate or bisglycinate because I'm seeing so much muscular tension and insomnia in my practice. I use magnesium bisglycinate a lot. And this is another example where I would either use magnesium bisglycinate oxide or orotate for the purpose of keeping vitamin D status normal in a patient. Anyways, that's what I wanted to cover today. So another holistic health video, this one about vitamin D status and magnesium intake. If you're interested in videos like this, please subscribe to our channel. We're going to be doing more and more of them. Thank you so much for watching and have a great day.